Good morning, everyone. Welcome to today's webinar, Effective Treatment Planning Strategies for Client-Centered Care. My name is Kaylee, and I'll be your host for today. To just kick us off, please let me know where you're coming from, what your specialty is. I'm always really curious what populations you all serve and what you specialize in, so I can just have a good understanding of who's in the room with me. Feel free to pop that in the chat whenever you get a chance. In the meantime, I will go ahead and get started. Again, my name is Kaylee Kron. I am a licensed master social worker and a certified grief counselor with the American Institute for Healthcare Professionals. I've spent most of my clinical career as a grief counselor for a local nonprofit hospice, walking alongside individuals navigating very challenging times in their lives. Greatest honor of my life. And now I get to hop on to webinars and trainings and talk about clinical practice and hopefully make the steps to being great documentation alongside being a great practitioner, like blend together in a way that feels really coherent. So I'm so thrilled to be here with you all. I'm seeing people pop in from Texas, Cincinnati, Illinois. Hello, Georgia, Ohio. So many incredible specialties. Wow. Thanks all for being here. It's always thrilling to see what webinars do well. I know documentation is something that we all have to do, and it is not often what we're best at. We have these two sides of our brains where we are in the client's space, we are spending time, we're getting to know them, we're working toward goals, and we're really vibing with them. And always keeping that documentation in the back of our minds can be challenging, and really thrilled to be talking about treatment planning today within the framework of how do we build it? How do we bring our clients with us alongside us so that they have an active role in those treatment plans? That's so important. And then also, how are we constantly changing those plans over time to make sure that they're still aligning with our client? Not just at the very beginning of treatment, but sometimes the goals that we set out are not aligned with like what is working well for them. And so staying flexible within the building of that treatment plan as well. So those are our learning objectives today. But before we get started, we have a couple polls. I want to understand where you're all coming from in regard to treatment planning. So I'm going to send out a first poll. What is your biggest challenge when developing a treatment plan? So feel free to fill that in. Just let me know what you all struggle with. I think we're all here for a reason. General education is, of course, very helpful, but let me know if there's anything specific that I can help with. And I'll do my best to get there. Okay. All right. While we collect responses, let's get started. First, why does treatment planning matter? I think for reasonably obvious reasons, we use treatment plans to guide the practice with our client from start, check ins to discharge. We always want to be working toward discharge. And if we don't know where that you're done is, then how will we know when our treatment time is done? So we have structure and direction for therapy. It also makes sure that the client and the clinician are aligned. Can you imagine them thinking they're working on one thing and you think you're working on another? That sounds like more of a personal relationship, right? And treatment planning brings a lot of clarity and purpose to the sessions that you're in together so we can check in more effectively. We can hold each other accountable more effectively, and we can make sure that we're on the right track throughout. And it also supports compliance, and it keeps us ethical within our standards of documentation. So very important. I'm seeing some answers to our poll, fine-tuning treatment goals, wording, doing it on the first meeting. Yes, that's hard because we're trying to get to know our clients a little bit before we decide how to help them out. I will suggest going back to, this is a series. So this treatment planning webinar is the third installment of our 5-part series, I believe. We did one on having a first kind of initial session before you even start talking about treatment planning to really get to know a potential client, make sure it's a good fit. I would suggest going back to that and just giving yourself a little bit more time to get to know your client. I very much support that strategy. I think it's really important so that we're not doing a ton of work only to find out that we are not a good fit. Okay. Thank you for all of these answers. Making measurable goals, interventions, we will talk about that. Putting too many steps. Yeah. Yeah. Because we want to get granular. We want to be able to measurably look at outcomes, and we don't want to make it so granular that it is really hard to follow and it feels a bit too prescriptive. I hear you there. So within the webinar, we're going to go through several of these key issues, which is exciting to see that this is what you're here for and we're aligned. Look at us coming up with our own treatment plan. So, what are the key components of an effective treatment plan? The first is, of course, that the goals that you set in place are client centered. We have talked in previous webinars within this series about making sure that the client is at the forefront, what their needs are, what their goals are, regardless of personal beliefs, where you're coming from in your own life. Like ethically, how do we hold our client to the center of this treatment model and leave ourselves at the door? I think that probably resonates with every single one of you. It's like a catchphrase for clinicians. So we want to make sure we're reflecting their needs, strengths, and values. And that is the middle. We also want to always make sure that we're having measurable objectives, that they're clear and that they are trackable in allowing us to track the progress over time. Because you don't want to set a goal that you can't really tangibly figure out, are they doing it? Is it going well? How is it helping? How is it supporting us toward our discharge goals? We also want to make sure that we have evidence-based interventions in there. We want our client to be a part of the planning. And so they may have things that they want to work on that potentially are a bit more personalized. But we also want to make sure that within those personalized goals, we're adding layers of evidence-based practices. And we'll go into that a little bit in a following slide. And then within the framework of a treatment plan, making sure that we're always open to revisions. You may think, as somebody who does treatment plans on the very first visit, you may have your treatment plan set, and a couple visits in, it is not working. It's not going well. Maybe the goals were too big. Maybe they were too broad. Maybe they were in a direction that the client thought they wanted to go, but it really isn't aligned with their lifestyle, comfortability, etc. So we need to adjust it. And all of that is fine. I want to give you an example of what this looks like. So let's say we're working with a teenager. We work with teenagers. I give you so many kudos. I think that you're angels on earth. I've worked with teens in grief settings, and getting them to really come to a clinical actively plan out a treatment plan can be very difficult. So I want to hold space for that really quick because that is just a hard population. I think we don't talk about that enough. So let's say you're working with a teenager with depression and they struggle with motivation. So a client-centered goal would look like improve daily functioning and energy levels so that they can start moving. What is that measurable objective? Engage in one enjoyable activity for at least 10 minutes, 3 times a week for the next month. That is a lot of data points, right? So we can be able to say, okay, did they do 1 out of 3 times per week? 2, 3, did they accomplish it? Are they working toward it? So it really gives you a lot of leeway to talk through progress, what direction that progress is going. Does it seem to be helping their overall mood? And then within that very specific goal, what is that evidence-based intervention? Behavioral activation. And then we add some journaling so that we can see, are you feeling better? Are you feeling more motivated based on your self-report that within your daily life, not just when you come to counseling? And then again, as we're looking at this goal over time, how is it going? If we are seeing this client every single week and every week they're like, I didn't get to it. I didn't get to it. Then what if we revised it so that they could feel more successful? So that they could, because if a client just comes in and they feel like they're failing or they're not wanting to participate for whatever reason, they're not gonna feel motivated with a reminder to do it. So, how can we break down barriers to what is blocking that client from participating other than sheer power of will? But can we break it down a little bit more? Can we look at, let's define the enjoyable activity? Let's say 2 times a week or 1 time a week. Let's do baby steps. Let's figure this out together. So, be open to that revision. It can be easy. And I've been in clinical settings where it's like they're non compliant. So, we're going to discharge them. That's not going to help walk your client to a place of a more positive mental health. And so just being able to be flexible, because these individuals are coming to us because they are having mental health concerns. If they could do it on their own, they would do it on their own, right? I have, okay. I want to just send out one more, because I love to know where you're all coming from again. As we're getting deeper into the documentation piece, what documentation barriers do you face most often? This is really helpful because remembering to do documentation is mine. I'm going to own it. I'm going to just own it, but it's important and we know. So we all face challenges within documentation. Again, I believe that's why we're all here today, is to just get a little bit better. While you're answering that question, let's talk about measurable goals. We could talk about SMART goals. We're going to talk about SMART goals, as we always do, right? Like they're just helpful in giving us very specific, measurable framework under which we can continuously assess how our clients are doing. SMART is specific, measurable, achievable, relevant, and time bound. All of that to say, a goal cannot be accomplished in the absence of knowing what it is, how we're going to measure it, can they even do it? Is it something that fits into their daily life that feels relevant to them? And how long are we doing this for? So we ensure the goals reflect the client's language and priorities. So making sure that, again, if you're working with a teen, if you're working with a child, those goals are going to look really different than if you were working with an adult, because everybody speaks a different language. They care about different things, their social circles, their ability to participate in external activities. Like a child relies on parents to help them do that versus a parent or an adult without children, an individual, they can go about getting those things done on their own. So really thinking about how we're making sure that these goals are doable for where our client is within their life. For example, we obviously want our client to feel less anxious if they're struggling with anxiety. What can we do about it? How do we make that measurable, tangible, relevant? Practice deep breathing exercises 3 times daily for 2 weeks. That's accessible. That's something anyone can do with a little bit of coaching. And it gives you timelines, specific and measurable. So then we look at the progression within that, within an initial goal, and then how we revise it over time if it's going. So the initial goal would be to leave the house for a short walk every week or twice a week. So you set that with your client, you're checking in, it's going well. So now how do we increase that and get it a little deeper and a little bit more meaningful to make sure that they're not just feeling good within accomplishing a goal, but moving forward in their ability to deepen those goals. So we revise goals after progress from just going on a short walk twice a week to attending a social event for 30 minutes a month. For me, that's a big goal. But it also it steps it up from an independent activity to social, being around other people, but it decreases the frequency and it decreases the amount of times they have to do it. So you're not going way, way out there and giving up a lot more of their time. Like once a week, you'll go to a event for an hour. That's a lot to give and hard to achieve from a walk twice a week all the way to that. So making sure that those goals are step by step. I am seeing answers in the chat around what are your barriers. I love doing it. That's, yeah, that is, it's just hard. I think I always say this, there's 2 types of clinicians, ones that are killer at documentation. They always have it done. They're always caught up. They are stellar. Like they just look good and they're readable and you could use it as a template. And then you have clinicians that they will get to that documentation they promise. But yeah, we don't have a lot of time. And as clinicians, depending on how you are compensated for your time, we're not always paid for our documentation time, which can be very difficult to then elevate it in priority because we have a lot of other things going on. Be gentle with yourself. We know that this is important. I think what is helpful about ICANotes is that it makes documentation very easy, quick, accessible. We're going to have a demonstration of documentation within the treatment plan a little later in this webinar. So I'm going to give you the tools to make it as easy as possible to get this done because I know personally, like I'm doing this series as someone who is I like to be in the room with the client. I forget to do my documentation. I need to sit up for a couple hours and get that done for the week. That's a me. So I'm here with you and I'm speaking from a place of I also struggle with documentation. So thank you. Thank you for that. Okay. Okay. So then we want to make sure that all of our goals are aligning with evidence-based practices. Of course, we have some good, heavy hitters that are going to be helpful in a lot of clinical settings. We have cognitive behavioral therapy, of course, for anxiety, depression, motivational interviewing for how do we help a client go from where they're at to where they want to be. And then we have trauma informed care. Those things are great. And I think when you can really dig in and understand how those practices can then be turned into actionable treatment plan items, you're golden. You're going to be able to have some standard things that you go to from a clinical perspective to ensure that the things that your client wants to do can be tied back to that evidence-based practice. So we're going to go with an example of treating PTSD. So a client goal is reducing nightmares and flashbacks related to trauma. So the therapist strategy, so again, going to that evidence-based approach, right? Exposure therapy, cognitive restructuring. And then so how do we make that measurable? So you take a practice and then you put it into what are we going to do? Practice relaxation techniques before bed each night, 4 weeks, track changes in nightmares. So we're taking that strategy from our clinical perspective. We're giving our client tools. What are relaxation techniques that we're going to try? Being able to do that in our clinical setting so that they have the tools they need to do that before bed. You turn we're going to practice this into you're going to be able to do it. And then we're going to see how that's impacting your dreams. Measurable. So we also have been talking about revising treatment plans over time. There's many reasons. There's a couple reasons why you would do it, but we want to always be reviewing the progress of our client. The goal, I think on broad strokes, the goal is for the client to feel better, to accomplish their treatment plan and to discharge and not need you anymore. Working yourself out of a job and out of a client is the gold standard. But it also helps us look at how are they doing over time as we're seeing them? And are the goals that we're setting in place showing a change in their affect, how they're showing up to therapy or their counseling sessions, how they're engaging in social, and you as the clinician kind of being able to track that presentation and how are these goals going, it allows us to say, you know what, I think we might want to wiggle these a little bit and see if we can't increase because I'm seeing you're doing a great job. You're checking all the boxes. Let's make this a little harder. But also the opposite. This seems like it's feeling really hard for you, insurmountable. Let's walk it back. Let's make it a little smaller so that we can feel successful together. Because clients feeling successful is important. They're not going to get better if they feel like they can't. And always just make sure that when you're revising treatment plans that you're updating, like if you're working with an interdisciplinary team or multidisciplinary team, you are connecting with them and saying, hey, I'm noticing this. Here's what we're going to do about it. So let's look at an example of that. A client's working on emotion regulation. Initially, they set a goal to journal daily. But a daily journal feels overwhelming. And that can be true for a lot of reasons. If you're not a journaler and suddenly you're expected to talk to yourself on paper every single day, that's a really hard adjustment. You might have family, work. You might be really tired. If you're struggling with anxiety and depression, doing a journal every single day can feel overwhelmingly hard. So, how do we break that down? How do we make them feel more successful? How do we help them feel more successful? We reduce the frequency. There's no one telling us we have to stick to what we set in place in the first place. And if it doesn't feel good, if it's not helpful, stop. Let's revise. And I think it also, with being open to those revisions, it shows a client that, like, you're allowed to change your mind. Things are allowed to change. You're allowed to adjust. This is supposed to work for you. Let's make sure we're doing that. And in that way, you're really advocating for your client. And some of the most successful treatment strategies we are scaling goals, which we've talked about, is you start with something small and then you work your way up to an ultimate goal of how you want to, how your client wants to present or be feeling when they are ready to leave you. So the first phase is they're attending a support group once a month. They're doing great. So you scale up. The next is I want you to engage in a group discussion at least once per session. Personal sharing every single time. That isn't something you start with. Not for many people who maybe struggle with social anxiety. That can be really difficult. So just be there, be in the room, get comfortable, then start sharing. And then phase 3, in an ideal world, they are, let's say, co-facilitate a support discussion if that's something that feels on their heart to do, right? So it shows little by little, you would never start with co-facilitating a support discussion, right? That's not a step 1 for somebody who doesn't go to support groups. So it's really looking at where do we want to be and how do we work our way up to that in steps. We want to always make sure that we are thinking ethically within the treatment plan. Autonomy is really important because they need to be on board and they need to want to do the goals and want to get to that end space. You don't get to tell them what their goals should be and who they should be and how they should be feeling because they know as a person, you need to have autonomy within your own treatment planning and who you want to be and how you want to be presenting. What do you want to work on? But it also helps increase accountability. If they help build it, they're invested. But we also make sure that accountability is realistic and we're making sure that the interventions feel aligned with the person and how they want to be versus what we are projecting on them. We also always want to make sure that we're looking at equity and cultural competence and we're individualizing care. Everybody comes from different backgrounds, hobbies, social systems, cultural backgrounds. And so you're wanting to look at and get to know them through that biopsychosocial assessment that we talked about in our previous webinar. You want to get to know them so that you can build a treatment plan that applies to their specific life, not, well, based on what I like to do, right? Because we all have different interests regardless of cultural backgrounds, but that plays a huge role. We have a couple examples of that. We had bilingual clients struggling with cultural stigma and therapy. So, what's that ethical consideration? We want to provide resources in their preferred language so that we can work through sessions, but is that a barrier that is insurmountable? If not, that's amazing. If referring out, but making sure that if they stick with you, you're giving them materials in their preferred language so they can deeply understand what's going on. And then also recognizing that there are different cultural perspectives that should always be taken into account. Okay. So we are going to watch a little video vignette of a client and a clinician working toward building a treatment plan together to give you an example of what that can look like.
Okay, I've been struggling lately with having a sense of self. A lot of things are changing in my life, and I'm not really sure how I feel with stuff. I'm getting older, and my kids are getting older, and I'm not sure who I am in all of that. And I'm struggling with aging, honestly, and not being in my 20s. And I'm in my late 30s, so soon to be not even in my 30s. So I'm really feeling sad and confused about who I am and what that means. My body is changing, and like my hair is going gray, and eventually I'm going to start getting wrinkles. And I'm concerned about how that is going to impact my interactions with my husband. Is he still going to find me attractive? Is this going to be a body that I even recognize as my own? How is, I don't know, just the world going to perceive me anymore if I'm not everything I was told that I need to be? Young, thin, pretty, all of that.
That all sounds very, while I want to normalize that this grief that you're feeling is very normal. It
Okay.
is. But it also is not something that people typically mark as grief. So I want to just say, hey, that's really cool that you did that. It's really great. And that shows the self awareness of I recognize grief in my body and that this experience is tied to that. And I think that shows a lot of a high level of self respect.
Thank you.
Commend you on that.
Thank you.
And just based on what you shared with me today, this is absolutely aligned with our grief center and what we can do within the scope of our practice. We'd be happy to bring you on as a client
Okay.
and move forward.
I have been diagnosed with anxiety, so I am taking a medication for that that was prescribed by my doctor.
Okay. And are you currently seeing your doctor to just manage that medication and how you're feeling on it and making sure it's working for you?
I am, yes.
Incredible. When you think back to losses within your family that happened, how did your family typically react to those losses?
My first reaction is not great. I'm not sure what great looks like, to be fair. But my most recent loss was that of my grandmother. Lost her actually December of 2019, right before the pandemic happened. So, of course, our family was prevented from grieving together and a lot of the grief process that we had planned. So that was difficult, but for so many other reasons besides the fact that our family doesn't really discuss grief together. There's a lot avoiding and pretending it's not happening and trying to just move on rather than sit in those moments and process.
And when you think about that kind of glossing over and not really like digging into that grief, do you see that spilling over into how you typically address major changes or losses within your current life?
Possibly. When I experience changes, it can be a little upsetting. I like things the way that they are. Also, probably some undiagnosed ADHD and anxiety there, of course. I like to know what to expect. And so when things change, especially when I don't expect them to, it can just throw me. So it probably takes me a little while to catch up to life, to catch up to what's going on and feel like I have control again. That lack of control, that can be really unsettling.
Yeah. When you say it, bro, what feel like in your body? And then how does that come across to like your spouse?
Yeah, I've discussed with my husband, we call it when I'm spiraling. So that's our fun phrase for it, where I used to shut down and just go quiet. But fortunately, many years of marriage, we've gotten to a point where we can communicate and I can say, hey, I'm having a hard time. I'm spiraling. Can you sit here near me, but give me 20 minutes to form the words to say what's going on? And then I want to bring you in and I want to tell you what's upsetting me. And I want to have you throw some logic at me and help me not be so emotional about this situation.
When you feel like you're spiraling, what practices do you engage in that help calm that spiral?
Breathing and a lot of the same techniques that I try to implement when I'm having any other kind of an anxiety attack. It's focusing on sights and sounds, lots of breathing techniques and counting. I'll usually instruct my kids when they're having a hard time and the emotions feel too big to do a candle breath. And so I'll sometimes use those myself. I've never really been religious. When I was a teenager, my parents encouraged that I go explore some other religions, go see like what fit for me, and never quite found a good fit. I guess you'd call me agnostic. I am a working from home, stay at home mom. I'm a contractor for a nonprofit, and I only do that about 10 hours a week. But other than that, I stay at home. So I maintain the home and I'm available for my kids, whatever might be happening before or after school, because they are school age. So that adds a lot of flexibility to my life, but it's also sometimes a little isolating because I don't leave the home to go to work. A lot of my work is more related to spreadsheets than video meetings or anything. I don't see a ton of people aside from the grocery store or my husband.
And for some people, that's very energizing or comfortable. For some people, that doesn't feel good. So if you were to like put it on a scale of like worst fit to best fit for you and your personality, where would your current amount of socializing fall?
I'm usually an introvert. So mostly I'm pretty happy about this. I enjoy just watching movies on the couch in the evening. That's a good time for me. But sometimes I need that social interaction. So sometimes I need a girls' trip. That's really recharging for me. So I am probably lacking in that little more that I like.
Who, if you had to define three people who are your go tos?
Okay. Number one is my husband, 100%. And then my sister, she's probably my best friend. We talk almost every day. And then my best friend from college. We talk almost every week, more if possible.
I want to ask you a little bit about your relationship with your husband because I would imagine that is the closest one that you have. So tell me about the supportive relationship that you all have.
We've been married for 10 years, together for going on 14. I do have two other best friends, but like he is that best friend, everything else. He's the first person I talk to about everything, to just like the nauseating details. Yep, you know everything about me, and I'm happy that you know everything about me, and I know as much as possible about you. He's that person that I want to share life with, so I'm happy with him.
You have people to connect with. And so, what's really fabulous is in the midst of great grief and life changes that you're experiencing right now, you have a very solid foundation. And so, really, in looking at that, and as we build your treatment plan, much of the work of building is there. So now it's looking like how do we cultivate those and make sure that we're clicking things in the right spot to make sure that you are feeling supported during a time of a lot of change for you that's making you uncomfortable. Okay, Jenny. So, based on our conversations that we've had over the past few sessions, it sounds like we have two overarching concerns that you're bringing into this counseling. And it looks like we're talking about self compassion throughout body changes associated with age, and then also finding a new satisfying identity in this phase of life.
Yes.
So, let's zoom in to that first goal around self compassion and acceptance on body changes.
Okay.
What would progress look like to you?
Finding a way to be somewhere between neutral and positive when thinking about my body.
Yeah, absolutely. So, when you think back to a time when you felt neutral, good in your body, what are you typically doing?
Probably when I'm going for a walk in the neighborhood with my kids and they're riding their bikes.
Interesting how feeling good in your body also is really associated with this very positive identity of being a mom.
Yeah.
Yeah. Okay, we're going to put some kind of values based movement. So that just means something that fits well into your day to day life that feels good to you and you feel good in your body doing it, movement. But we're also going to pair that with some cognitive reframing that's going to help you do those activities that make you feel good in your body and reflect on those feelings that you're having so that we're pairing body and mind within this overall goal.
Okay. Great.
Okay. but we'll do that in session together.
Okay.
And then we'll also be doing some homework around journaling, affirmations, and that kind of thing. So a little bit of body, little bit of mind for this goal. How does that all sound to you?
That sounds really good.
Okay, great.
Thank you, Kaylee. That was a fantastic session. That was absolutely wonderful. Can everybody hear me okay? Is everybody able to hear okay? Yes, thank you, Cindy. All right, I will be sharing my screen. Give me just a moment. And I will be going through the treatment plan in ICANotes. I'll be showing you several different treatment plans. Thank you so much, everybody. Tracy, Patricia, Crystal. Thank you, Amy. Fantastic. All right, so let's go ahead and you will see my screen. So this is ICANotes. I'll just run out to the dashboard. This is ICANotes and what it looks like. And I'm going to take you directly into a chart room. And we're going to go into a patient's chart. I love all the colors on the chart. And then we're going to go directly into a treatment plan. So to add a new treatment plan, I can just go in and I'm going to do two, but I can add a new treatment plan here. And I'm going to say webinar. It's the treatment plan for the webinar. I could put in last done or next to. Go ahead and add that in there. And then I can add my problem in, just going right up to the top, add new. And then our treatment plans are multidisciplinary treatment plans. So we have the social in there, like determinants of health. We have medical, rehab, and then psych. And so I'll go ahead, I'm going to select psych, and then I will go in. And first, we're going to do anxiety. Okay, so I'll grab anxiety there, go ahead and close that. And I'm going to say that there was definitely anxiety. There was also depression. So I'll go back through a depression treatment plan as well, but generalized anxiety disorder. And there was some worrying in there and maybe the shift of focus of worrying. And then we also had lack of self compassion. That was a major theme, right? This is in plus, Amy. The great question. This is in plus. I'm happy to show it in classic as well. It looks a little bit different on the interface, but I'm happy to show it in that as well. As far as self compassion, we have, again, excessive worrying, negative self talk, some intrusive thoughts, excessive worrying. Now, the long term goal, and you just literally walk down the tabs. So it makes it really simple. And I'm explaining the whole time, so this is taking a little bit longer. But the long term goals, I'm going to put self compassion and acceptance. That she's going to develop a sense of self compassion and acceptance towards physical changes associated with life transitions. And then I'm going to move over into, and as you can see, this is all copying this over here on this side. And I'm going to go to my short term goals. And so we can talk about maybe identifying negative self talk. We can talk about affirmations here. So that she's going to engage in self compassion practices like affirmations, reflective journaling, and she's doing it 3 times a week. You like to see that, insurance companies especially, but it's good to use quantifiable goals. And so this is 3 times a week to increase self acceptance and reduce negative self talk. So I've got that in there. I can put the frequency, the time, the duration, the progress, even the status. And I want to show you on my status really quickly. We have statuses of effective or ineffective. And then I can put movement practice. So I'm able to select that. And she'll participate in movement practice that brings joy, whether that's yoga. Walking was one thing that was discussed at least 2 times per week to reconnect with their body in a positive, non appearance focused way. And then also identifying patterns. So she's going to identify and recognize patterns in body image thoughts through weekly journaling to support increased awareness and cognitive framing. So I have those in there as well. So I'm able to talk about those. Then I can go up. There's a lot. Someone just commented, there's a lot. Yes, there is a lot. I have the ability to identify negative self-talk, to identify nature of fears, identify negative thinking. So that could be a short-term goal. And then I can move over to my interventions. As you can see, I have lots here, but I could say that we are identifying negative thinking. And so I can add short term goals to that. And then I can identify affirmations, movement practices, negative self talk. And you see here, oops, refreshing there. You see here on this side, I have all my long term goals, all my short term goals, and then I can absolutely drop in my interventions. And again, we're multidisciplinary. Misty said, I like that better than the one we have on our platform. Yes. And then therapists, counselors. I can move under all of these different ones. So identifying negative self talk will be in there. And then when I scroll down there, we have that we can provide psychoeducation. So we can teach emotive vocabulary. We can identify self defeating talk. So all of these things here. And then I'm able to go over and just keep looking at my goals. And as you can see, they change depending on what the goals are. Right? Yes, exactly. All right. And then I can move over into my strengths and whatever the strengths may be. Maybe it's family, maybe it's motivation. Maybe she has lots of motivation there. She's motivated for treatment and it's good motivation. She was great with communication, right? Excellent. So she communicates effectively and has really good communication skills. And then I can also put some barriers there, whether it be, and there are kinds of barriers there. That could be financial barriers, it could be cultural issues. Sometimes it's motivational issues with some folks. Sometimes it's cognitive limitations with individuals or socioeconomic status. What do you think a barrier? You guys tell me, what do you think a barrier was for her? Love to get your feedback. What do you think a barrier was for her? Any thoughts on that? Got a question. Amy says, when doing the frequency and time period, that's the goal for itself. Yes. Yes, exactly. That's exactly. And if you're working with Medicare or Medicaid patients, you absolutely want to have the goal, the time period for the goals in there, and you absolutely want to have the clinician's name on the intervention. Barrier is her time. I like that. Absolutely. Absolutely. So I would just go in here under barriers. Great answers there. So I could click anything, but I could go in here and really just, I could take that out and say it's time. Time is a barrier. Self-esteem is a barrier. Excellent. Or self-esteem is a barrier. Motivational issues. There weren't there. There actually were some motivational issues there. So I can just change that up here. Absolutely. What else? Accepting changes. I like that a lot. Yes. Accepting changes. Limited social skills. Isolation. Great. Great feedback. And so I can just do limited social skills, isolation, love it. Self confidence, absolutely. Great ones there. So she wants to, again, all great. Thank you guys so much for participating. You have excellent feedback. All right. And then I can go ahead and go in and then go to the plan status. In that, we have the SNAP assessment, the BPRS 18, and these are because many organizations or states require those. And so we have that. I can review the medication. I can review the diagnosis here, there. I can also add a justification of level of care. That's because I need more sessions. I need this patient, I need to continue to see her. So outpatient is still needed because it's interfering with her day to day function and she's unable to self alleviate. Okay, so I can save that directly into the treatment plan. And then I can compile this treatment plan here. So compile and preview. And then I have a really nice treatment plan that appears that I worked on that all day. Right. So very good. And I can go ahead and compile that. We do have, Angela, we do have treatment plans for children. I would love, we can actually meet separately and I can go through all the ones that we have for kids. We have a really robust treatment plan and we have some on family communication. So that's great. Absolutely. One of the really great things about ICANotes, and Kaylee, do you want to take back over? Then I'll share ICANotes again or go through some of the features, or how do you want to do that? Sorry.
It doesn't look like we have a lot of specific questions on my presentation and more so on the software. So why don't you just keep going?
Okay. All right. All right. All right. But if you guys have questions, I'll put them in the chat. You're very communicative and I love it. I love it. So this is iCannotes. A lot of you are saying it doesn't look like my program. No, this is like the newer, neater, cleaner version of iCannotes. It is, we are taking everything that's in iCannotes and putting in what we call iCannotes Plus. But iCannotes Plus can do a lot of things that iCannotes Classic can't, and it's because of the platform that it's on. One of the things, if I could just show you really quick, if I'll look at all charts, let me put Dwayne Johnson. Okay, let's go into Dwayne Johnson's chart. There he is, the rock. All right. So what I could do here is in iCannotes Plus, you're able to actually go to the client portal and you are able to send forms and assessments and packages, intake packages out to your clients. So if I wanted to send a package like an intake package or a weekly assignment, I could absolutely do that. I could also go in and look at forms for them. I could look at practice forms, development forms, all assessments. I could go in and say, I'm going to send a PHQ-9 to him. And then I could send that to Dwayne Johnson. So it's absolutely geared toward mental health. The one you use is more medical environment, yet this is completely mental health. And so now I've sent him out all the forms he needs to fill. And here's a beautiful thing. When he fills out those forms, it will alert me. And those forms will go on his chart, but it will alert me that he filled out his forms. And I can see what the status of those forms are, whether it was sent, if it's in progress, things like that. Another feature that I really love on ICANotes Plus is on the quick calendar, you have the ability to have people schedule with you online. So you have the ability for online scheduling. And all you have to do is grab this little link right here and stick it on your website, and individuals can fill that out and get appointments directly onto your calendar. Another thing with a calendar we weren't able to do is to put it to be able to integrate with your personal calendars, like your Google calendars. Now, there is some hiding of PHI in that, but you can look at your personal calendar from this calendar within your EMR and see when you have appointments. Shanna asked, can he fill it out electronically? Absolutely fills it out electronically. Can do it on the phone. Yep, absolutely. Let's see. If I were to switch to Plus, would previous treatment plans be available? That's a really good question. So, Amy, what we do is if you're on Classic, we call it Classic. We don't want to call it old, right? So we call it Classic. And we will take those treatment plans and we will then put them we'll download them along with all of your notes into the Plus program. So you have it there. Very good. Shanna said, does he have to have a user profile, or is he using Adobe on his device to fill it out? He's signed into the portal. That's a really good question. He's signed into the portal so that all the forms come through the portal so they can fill out on the portal. Now, the calendar invites, they don't have to go through the portal for that. Not at all. They can just schedule with a link. So, absolutely. What Rory says, will this work for couples? It will. It will. That's a great question. So, if I go to the chart room, I'm going to go back to the last chart, the rock here. We have lots of different note types. And so we do have a couples family therapy note. We have quick notes. One other note type that we have in Plus that is not available in Classic is our SOAP note. So our couples and family is available in our Classic program. So I'll just go through that. I could go to the group type and I could say that this is a marital family couples. We could talk about the case type, that this is maybe it's higher marital distress going on. Current functioning is that they argue frequently. Okay. So argument is frequent arguments, and have really low insight into their personality differences. And their today's focus, we can go in, whether that be infidelity, whether that be money issues, management, and maybe income disparity. Maybe there are lack of communication going on, of course, intimacy issues and poor emotional support, all of those things. And you can add to that. And then the interventions that you would do. Maybe we could do some blame reduction here and listening skills, positive conversations, and reducing reactivity. So you're able to do all of those here in the program. And then one of the things that I really like is that is not available in Classic is that you can go and create your own custom content. So I can go here and I can add custom content. And maybe I put something out like dinner dates, okay? Or I could go even as far as what is it, skin to skin contact for 15 minutes, but I'm just going to go dinner dates. We're going to go PG here for this, but with couples therapy, but I'm going to go dinner dates and they will go to dinner one time a week, something like that. And so I go ahead and save that. And that now becomes my custom button and it's here. Now we still have the custom buttons on the right hand side. If you're used to them in Classic, we've got them on the right hand side, but I've got them here and you can take your buttons and move them about so they're all there. And then I can remove some. If you're like, there's got to be some buttons in Classic, you're like, there's buttons here I never use, create a map. I'm just going to get rid of it. It's there. I can always bring it back, but create a map is gone. And now you'll see dinner dates is there. So really easy for putting your own content in because we want you to make the system your own. And we absolutely help you do that. Compile and preview that. You can also link to treatment plan. You can justify level of care. You can enter private notes, do verbal content, things like that. But I have a nice note there. And then let me go. How many of you are interested in the soap note? If you are, just tell me. If not, I'll skip it. I'll drop into a little bit. But we have the soap note where we have the symptoms reported, and you can go into that. I can say, oh, they're having depression and guilt. There's guilt there and hopelessness and those things. And I can go through. And then current stressors, I can talk about that a little bit. And then objective, I can say what I observed symptoms wise. I can say that there's some PTSD. And then as far as behavior, I can go into behavior and say there's problems with sleep, falling asleep, staying asleep. There's substance use that is much more than advised. Functioning at work is really impaired. Social behavior is completely isolated. And then I can go into the assessment and do a mental status exam from here. If it's normal, I click normal and move on with my life. So I can absolutely, if there's things that are going on here, I can remove here, like a normal attention span is evident and there's no signs of hyperactivity. I can remove that and talk about how they do have distractibility, things like that. Also, your rating scales. One of the really nice things about Plus is it will pull in your rating scales. So before, if someone goes into the portal, we sent the Rock a PHQ-9, it will pull his score in. Right now, he doesn't have any, but if he had filled out that PHQ-9, I could literally go here, type PHQ-9, and whatever his score is would just populate into my note. That's it, a one click. You can still go in and populate it yourself if you want, but just a one click and done. So I can do my suicide risk assessment and say they're not suicidal. And then I can go to my plan, which is I could link my treatment plan directly in. So I just pull it in. I'm not sure which one I'm pulling in here, but there's a lot on the Rock. Okay. And so here we go. And there I linked my treatment plan in. And then I can go ahead and finish my note. I can enter medications, diagnosis, all those things, and compile my note really quickly. All right, great. Yes. Yep. So that's the whole thing. All right. So very good. Any questions? I'm going to turn it over to you. I'm sorry, Kaylee. I talked way too much.
No, I think that was so helpful, really comprehensive. I worked for a local nonprofit hospice and just did not have the type of software that ICANotes offers. And so it's just really thrilling to see how far documentation has come and this specific software, how incredible it is. I think it's so great. And obviously, people had a lot of like very specific questions within that. So thank you for going over that in such detail. That is our full presentation for today. And I appreciate everyone so much for being here. We are, as I said, in session 3 of our 5-part series. So please feel free to join us for our next one in about a month. And I believe, yes. So I saw a lot of people talking about, wow, we don't use this software, but gosh, it looks really nice. I would always encourage anyone to just sign up for a tutorial. It's very cool. Otherwise, I thank you all so much for being here and just spending time with me today. And I hope to see you all at the next one. Please take care. Bye.